Mark Wilson here from Midwest Orthopedics at Rush in downtown Chicago. Don't worry, I'm not injured, but I was. Had a torn meniscus in my right knee, but this guy right here helped me out, got me back on track 4 years ago. He's the head physician for the Chicago Bulls, does some work with the White Sox as well. Dr. Brian Cole, thank you for being on Mark It Down.
It's good to see you.
First of all, we got to talk about the newest member of the Chicago Bulls, a fellow Tar Heel of mine, Kobe White.
Yeah.
How's he liking Chicago so far?
Well, a day like today with snow outside, I'm not sure he's liking it very much, but he's doing great on the team. He's a quiet guy and just does his job, and he's gonna, I think, in a couple of years he will probably emerge as a leader. So
cool.
I'm a big fan. It's a terrific addition to the organization.
I'm sure he's found Blue Malnati's and Garrett's popcorn and all that.
He's his diet. He's got a good diet, so he's not going that direction.
You got to splurge occasionally, right? But let's talk about the PGA Tour a little bit, and more specifically, left knee injuries. Whether it's Brooks Koepka, who had the torn patella tendon, or you got Tiger Woods, Dustin Johnson, both had surgery in August. We know Tiger Woods came back great from that left knee surgery. That's his 5th left knee surgery in his life. What gives?
Well, one of the interesting things is all 3 of those guys had lead leg injuries, right? Mm-hmm. So there's some decent data looking at why the lead leg is more relevant. The first thing is, and again, I'm not an expert golfer, that made me a much better golfer, but the lead leg starts in a slightly flexed position, right?
Yep.
And then it goes rapidly to extension as you follow through. Mm-hmm. And the theory is that when we look at the forces across the knee, the lead leg sees somewhere between 100 to 400% body load due to rotation as it rapidly goes from a flex to extended position. So the theory is that most of these guys don't get acute injuries, meaning sudden pain. Mm-hmm. They're usually progressive degenerative things over time. Yeah. So the theory is that the lead leg sees more forces, mechanical forces, than the opposite leg, and that may be one of the reasons that we commonly see injuries in that leg. That's also important for us to know because returning a professional athlete back to sport, mm-hmm. or in golf, the timelines can be different if it's lead leg or the opposite leg.
It makes total sense.
Because the forces are so much greater on the lead leg.
Right.
So, the take home is that we think the forces are much greater in the lead leg. The mechanism is from a slightly flexed position to a rapidly extended position, which might explain the patella tendon issues that we recently heard about. And it might also explain from the rotational forces that happen to injure or at least aggravate cartilage problems and so forth. So
okay.
That's the prevailing theory, and then the question is, well, now that you know it, how do you fix it, or how do you prevent it?
Yeah.
People have talked about shorter clubs, spikeless shoes, things like that, but I'm not sure the reality. If you pay the price for changing to something like that to prevent those injuries, the data is very soft there.
Yeah, the guys are swinging at 120 miles an hour, so it's going to happen like that over time, especially with all the golf balls that we hit. Yeah. Tiger Woods, he's 43 years old. That's just going to happen. I think it's got mine was the right knee, so that's the shorter hitter's knee apparently, because I hit a lot shorter than those guys. Right. But anyways, mark it down. You heard it here from Dr. Brian Cole. Follow these tips, help you be pain-free longer to enjoy this game. If you want to follow him on Twitter, Brian Cole MD, or go to his website, briancolemd.com, for some other great tips. Enjoy the PGA Tour this week. They're down in Mexico. It's not snowing there. Mayakoba Golf Classic, something dear to my heart. Watch Matt Kuchar defend his title. Thank you, Brian Cole, for your time.
Great to see you.